5, Section 4. Adolescent development. Adolescent mood swings can be intense, which may lead to depression. Suicide rates are higher amongst teens, but it's often an impulsive act. In children and teenagers, it is unclear if antidepressants are actually effective. Adolescence is also a time of growing sexuality. Morality is determining what is right and wrong. This tends to be difficult in adolescence, and there's a conflict of what people feel versus what is reasonable. Pre-conventional moral reasoning based on personal consequences or rewards and punishments. In children, it is what is good for me. An example is children, what is good or bad for me. Conventional moral reasoning, judging based on society's expectations, usually seen in adults. What is good or bad for other people. Post-conventional moral reasoning, rules based on the social contract. Only a few people achieve this, and it is what is good or bad for everyone, including me. Erikson's 8 stages of development, or progressive stages of human development in which people decide how to behave. For infants, it's trust versus distrust. For toddlers, autonomy versus shame. Preschooler, initiative versus guilt. Pre-adolescent, industry versus inferiority. Adolescent, identity versus role confusion. Identity is a consistent sense of who one is. Intimacy versus isolation for young adult, also referred to as emerging adulthood. It's deciding who you are and what you want, moving from home, trying to make your own decisions about the future, taking responsibility for one's actions, having a vision of what you want, and feeling optimistic about life. Generativity versus isolation is middle adult, and elders are integrity versus despair. The aging mind. Young adulthood represents peak development. Perceptual and motor skills are finely honed. Despite the decline in abilities, overall satisfaction with life increases with age. Menopause, when the female reproductive system begins to shut down around age 50. Presbyopia, difficulty on focusing on nearby objects after the age of 40. Reaction times begin to decline as one ages. Fluid intelligence, ability to think and reason abstractly, greater in young adults. Crystallized intelligence, learning based on past experiences, based on a store of facts, greater in older adults. Perceptual speed, how quickly we can detect and process stimuli. It decreases with age. Older people tend to be happier. Alzheimer's disease. Dementia, progressive decline in cognitive function caused by damage or disease rather than normal aging. Dementia is a cluster of symptoms, not a disease. 2 major causes of dementia: small strokes and Alzheimer's disease. Alzheimer's disease. Most common cause of dementia results of a buildup of abnormal clumps of dead and dying neurons, neuritic plaque. Amyloid, protein that brain cells release, lead to neurotic plates. As one ages into the 90s, one becomes increasingly unlikely to develop dementia.